All. This is Dr. Mubin Sayed from Drbeen.com. Welcome to one more show. Long time, no live talk. However, for your time's sake, I'm going to plow through the topic today. So the topic is very simple. WHO and the MPOX, basically for the people here in the US, where I am, there is low risk for the US. And that is what CDC has said as well. So the US concerns, one should be aware of it, but there are low risk concerns for the US. It is primarily in the Congo, where 96% of the confirmed cases are appearing at this time. However, this is true that for MPOX, the number of cases have increased substantially within the African countries. And so that is why the WHO came out and said this is a public health emergency. I think they also came out to say that we need funds. And so these are the primary aspects of the talk today. So let's very quickly go through some of these news. This is Drbeen.com. And of course, there is a link in the description that you can get access to it, or you can just go to Drbeen.com and get lectures with CMEs. Here is where I want to start. So this is 8/9/2024. This is the lab advisory. CDC issues alert for MPOX in the Democratic Republic of Congo with spread to neighboring countries. So if you see here, this is what is for the US. Due to the limited number of travelers and lack of direct commercial flights from DRC or its neighboring countries to the United States, the risk of clade 1 MPOX importation to the United States is considered to be very low. CDC is helping communities monitor the presence of both clades of MPOX in wastewater samples. So there is a clade 1 and clade 2. There are two clades. On the other hand, the smallpox has 27 clades. And the smallpox has a very high fatality rate, for example, 30 to 50%. In the case of MPOX, the fatality rate within the African countries is about 10%. Fatality rate in the European countries is 1 to 3%. Then there is one of the cool beans here on the chat who said, hey, do you have number of cases across countries? So I started searching. So this link is not in the description because I started searching afterwards. But here is a data that I saw, multi-country outbreak of MPOX. And in here, if you see, this is January 2022 to 30 June 2024. That is 99,000 confirmed cases, 208 deaths, and 116 countries that are involved. Eastern Democratic Republic of the Congo and neighboring countries, affecting most adults and spreading predominantly through sexual contact, linked to clade 1b. That is high. Similarly, areas of Democratic Republic of Congo where MPOX is endemic, that is present within the society, affecting mostly children and spreading through multiple modes of transmission, linked to clade 1a, that is high. And then if you see, others are moderate. And down here in this table, there is a table here in this document. And if you see here, regions of the Americas, total confirmed case 62,000, total that's 141, and so on. So there is this table. You can afterwards pause the video and read this if this is of interest to you. Then here is WHO Director General. So before we go to the public emergency, let's very quickly look at the MPOX. I had done a few talks about MPOX 2 years ago when this was also it had become an emergency. So my talks here, how does monkeypox virus work? Nowadays it is called MPOX. Then here is monkeypox unexpectedly emerges in UK, Portugal, Spain, US, and Canada, again 2 years ago. And then my discussion with Dr. Tommy Zaharaki is about this as well. So these are 3 videos 2 years ago already present on YouTube for any further understanding of MPOX. But generally, the MPOX is a pox family virus, the same family like smallpox. That is why the vaccine kind of works for both of them. The viral infections usually have a similar pattern of symptoms, and that is headache, fever, rashes, sore throat. So in case of MPOX, these are the signs and symptoms. headache, sore throat, swollen lymph nodes because the virus is taken to the lymph node by the immune system, and then virus just continues to replicate there as well and causes swollen lymph nodes. Then fatigues, back pain, muscle aches, and then rashes. The rashes they go through the phases of developing a rash, becoming more swollen, bubble-like thing, then it bursts open, then it scabs over. And the fluids from those rashes have the virus in them. The person who is infected with MPOX has the virus in their bodily fluids. So that means their saliva, their tears, their semen, vaginal fluids, anal area, they would have the virus present. And secondly, this particular virus can be airborne as well if a infected person sneezes or coughs. It can be present on the surfaces as well. And for example, if somebody has rashes with the MPOX, and that person, of course, is sleeping in a bed, that bed may have the fluids from their rash on the sheets, and those would contain the MPOX as well. Similarly, other surfaces where that person may have touched could contain MPOX virus too, and these are called fomites. So going back here, if you see the key facts, orthopox virus, skin rash, mucosal lesions, which can last 2 to 4 weeks. The incubation time, that is when the person becomes infected, when the virus lands in that person to the point of developing symptoms, incubation time is anywhere from 6 to 13 days. However, 5 to 21 days have been reported as well. Hence, the recommendation is to monitor a person up to 21 days who may have come in contact with somebody else with the MPOX. Then once the symptoms appear, then usually within 3 to 4 weeks, the person goes through the whole life cycle and recovers. Sometimes that can be longer or shorter as well. The treatment, there are some treatments that are being researched, although other than supportive treatment, there is nothing else. Vaccines are also present, and they do not have, anyways, the vaccines are present as well, and they are for highly at-risk population. So this is the MPOX. Now let's very quickly look at what WHO is saying. WHO is saying the director has determined that the upsurge of MPOX in the Democratic Republic of Congo and a growing number of countries in Africa constitute a public health emergency of international concern, under the International Health Regulation of 2005. Then they say with potential to spread further across countries in Africa and possibly outside the continent. Then they say it's clear that a coordinated international response is needed to stop these outbreaks and save lives. Then their professor, so this was their meeting, the current upsurge of MPOX in parts of Africa, along with the spread of a new sexually transmissible strain of the monkeypox virus, is an emergency not only for Africa, but for the entire globe. So why they are saying this is that there is a new clade, I believe 1B, that has emerged, and they are talking about that. In July 2022, the multi-country outbreak of MPOX was declared a PHEIC as it spreads rapidly via sexual contact across a range of countries where the virus had not been seen before. The PHEIC was declared over in May 2023 after there had been sustained decline in global cases. So after that, MPOX has been reported in the DRC for more than a decade, and the number of cases reported each year has increased steadily over the period. Last year, reported cases increased significantly, and already the number of cases reported so far this year has exceeded last year's total, with more than 15,600 cases and 537 deaths. Now, please remember, 96% of these confirmed cases are in the DRC. And so majority of deaths are there as well. The emergence last year and rapid spread of new virus strain in DRC, clade 1B, which appears to be spreading mainly through sexual networks, and its detection in countries neighboring the DRC is especially concerning. In the past months, Over 100 lab confirmed cases of clade 1b have been reported in 4 countries neighboring DRC. So the reason I'm kind of reading these excerpts is to present to you that this is not an emergency here in the US or in Europe. It is primarily Congo and the neighboring countries. So it is definitely an emergency for them, but yet the risk is lower for the other countries. Last week, the Director General triggered the process for emergency use listing for MPOX vaccine, which will accelerate vaccine access for lower income countries, which have not yet issued their own national regulatory approval. And then down here, they're saying that here we need $15 million, and they had their own, out of their own funds, they have released $1.45 million. So this is the current state. Now, very quickly, I want to show you this as well, this one. This is CDC talking about MPOX and safer sex. I remember doing a video about this one and making some cartoons where 2 people are sitting separately within their own sheets and looking at each other and masturbating, because that is the one of the recommendations here as well. So what they're saying is, let me quickly explain the transmission in sexual routes. The virus, when it comes in contact with the mucous membranes, it can enter the mucous membrane without any problem. So a lesion, so imagine somebody else has a rash where somebody touched and then they touch their face, or so that can cause the infection on the epithelial surfaces. Similarly, imagine if a person is infected, and let's say that's a man and their semen has the virus, and then that semen enters the vagina or the anal canal of another person, which are also mucous membranes or epithelial membranes. Virus can easily then infect those surfaces. On the other hand, imagine if a woman or a man is infected and another healthy person is having sex with them, either vaginal or anal. In either cases, as the sex is occurring, there are micro lesions, there are micro tears that appear on the surface of the penis or the skin of the penis. So generally, penile skin is robust enough that the virus cannot enter through it. But when the sex is occurring, there are those microscopic lesions which create small tears through which the virus can actually enter and get under the skin of the penis. And then from there, it can infect the local tissue, or it can get into the blood and then go and infect other tissues. So this can happen with the rashes as well, touching the rash. And then if there are microscopic lesions on the hand surfaces, from there the virus can enter as well. Similarly, touching surfaces where the virus may be present because another infected person has touched that surface, that surface will be called a fomite. So let's see what CDC has said here. So what they have said is, take a temporary break from activities that increase exposure to MPOX until you are 2 weeks after your second dose. So if somebody has taken the vaccine, limit your number of sex partners to reduce your likelihood of exposure. Spaces like back rooms, are more likely to spread MPOX. Condoms may protect your anus, mouth, penis, or vagina from exposure to MPOX. However, condoms alone may not prevent all exposure to MPOX, since the rash can occur on any other part of the body. So this is important, that rash doesn't have to be on the genital area. So wherever the rash is, the virus is present in that fluid. And so touching that or accidentally coming in contact with that with mucous membranes would cause the problem. Then gloves might also reduce the possibility of exposure. If inserting fingers or hands into vagina or anus, the glove must cover all exposed skin and remove carefully to avoid touching the outer surfaces. My opinion is just avoid sex for 2 or 3 weeks. Avoid kissing or exchanging spit, since MPOX can spread this way. So that is, it is present in the bodily fluid and then it can enter through the epithelial membranes. Masturbate together at a distance without touching each other and without touching any rash. Have virtual sex with no in-person contact, and so on. So consider having sex with your clothes on or covering areas where rash is present, reducing as much skin-to-skin contact as possible. So I have this link in there. Be aware that mpox can also be spread through respiratory secretions with close face-to-face contact. Remember to wash your hands, fetish gear, sex toys, and other fabrics, bedding, towel, clothes after having sex. So this is the CDC on it, and this is about the mpox. Not much concern here in the US or Europe, mostly in the African countries, and WHO has declared that as a public emergency. I did not see any travel advisory, but I'm hoping that there will be some travel advisory for people from Congo from traveling to any other country, but I did not see that. So this is the discussion. Thank you very much for joining me today. I am live today for after months and months. So I have a question for you. Would you like these live talks more? My problem is when I do these live chit chats, the viewership is really low on these because maybe they're long or people just are not interested in these topics. So viewership is such low that it is kind of not fruitful to do these discussions. So I'm going to hang up now, but tell me, what do you think about it? And please like, subscribe, and share. There are links in the description if you would like to get access to Dr. Bean or if you would like to support this work. Plus, the links are in the description for the talk today. Some links I researched afterwards and they are not present. You can Google them as well. With this, thank you. Have a nice weekend and nice to see you all. Bye-bye for now. One more question. Do you think that on every Friday we should just do an open chit chat? Just a chit chat, half an hour? If so, let me know and bye-bye.